Let's talk about something that's still a huge taboo: urinary incontinence in young women. So many people think this is something that only happens after you turn 50, but today, I want to make one thing crystal clear. Yes, incontinence can affect teenagers and young women, and no, it does not mean there's anything wrong with you. In this video, I'm going to explain in a simple and approachable way what this is, why it happens, the different types, how to spot the symptoms, and most importantly, what you can do to treat and prevent it. First things first, what is urinary incontinence? It's simply the involuntary loss of urine. Sometimes it's just a few drops when you laugh or sneeze, and other times it can be more significant. And despite what you might have heard, this isn't just an issue for older women. So many young women experience this silently because they feel too embarrassed to talk about it. There are 3 main types you should know about. The first is stress incontinence. This happens when you leak urine during activities that put pressure on your abdomen like coughing, sneezing, laughing, running, or lifting heavy weights. This is usually a sign that the pelvic floor muscles, which support your bladder, have weakened. Then there's urge incontinence, which is also known as an overactive bladder. This is when you get a sudden, intense need to pee, and sometimes you just can't make it to the bathroom in time. If you have this, you might find yourself running to the bathroom all day, or waking up multiple times at night. And finally, there's mixed incontinence, which is simply a combination of both stress and urge incontinence. So, why does this happen to young women? Well, there are lots of reasons. Pregnancy and childbirth, even in your 20s, can weaken the pelvic floor muscles. If you're a young athlete in a high-impact sport like running, gymnastics, or CrossFit, the repeated pressure on your pelvic area can also lead to incontinence. Even things like frequent urinary tract infections can irritate the bladder and cause temporary symptoms. Genetics can also play a part. Some of us are just born with weaker pelvic floor muscles. And certain medical conditions, like diabetes, or even some medications like diuretics or antidepressants, can affect bladder control. There are also some risk factors people often overlook. Carrying extra weight puts more pressure on your bladder and pelvic floor. Smoking can cause a chronic cough, which weakens those muscles over time. And chronic constipation, which forces you to strain, can also do some damage. So, when should you see a doctor? If you notice yourself leaking urine when you run or laugh, if you get sudden uncontrollable urges to pee, if you're going to the bathroom more than 8 times a day or waking up more than twice a night, it's time to talk to a professional. Other signs include feeling like your bladder never fully empties or experiencing pain when you urinate. The good news is, getting a diagnosis is usually pretty straightforward, and there are so many effective treatments. Pelvic floor exercises, also known as Kegels, are incredibly successful when done correctly. A pelvic floor physical therapist can also work with you to retrain and strengthen those muscles. Simple lifestyle changes make a huge difference too, like maintaining a healthy weight, cutting back on bladder irritants like caffeine and alcohol, and quitting smoking. For some, devices like pessaries can offer internal support. For urge incontinence, there are medications that can help relax the bladder. And while surgery is less common for young women, it is an option for more complex cases. Prevention is also key. Keeping a healthy weight, doing your pelvic floor exercises regularly, staying hydrated to avoid constipation, and avoiding smoking can all make a massive difference. If you're pregnant, you can start doing pelvic exercises early. And if you're an athlete, you can learn proper breathing and pelvic protection techniques. I know urinary incontinence can really impact your life. It can affect your self-esteem, relationships, and even your sleep. But the most important thing to remember is that there is a solution. Most women see improvement quickly once they get the right help. If any of this sounded familiar, please don't blame yourself or feel embarrassed. You are definitely not alone, and this is treatable. If you liked this video and want to see more content about women's health, make sure to like, subscribe, and hit that notification bell. Thanks for watching, and I'll see you in the next one.